Cosmetic surgery is a very specialized branch of medicine which involves techniques to make a person look much better. The most commonest varieties of plastic surgery that I deal with are or can be categorized into surgical and non-surgical. Non-surgical, by far and large, are the most common procedures that I do. In the non-surgical modalities of plastic surgery, the commonest is facial rejuvenation. Facial rejuvenation may be done for various factors and various reasons, but the commonest facial rejuvenation procedure that we do is Botox, where we inject botulinum toxin injections into the forehead and certain areas around the eye, which are known as the crow's feet, to get rid of wrinkles and to bring back a fresh glow to a tired looking face. Botox can also be given in the form of mesobotox into different areas of the face to decrease pores and to give a better glow to the face, and also to tighten certain areas which have become loose. Apart from Botox, the commonest non-surgical interventions that we do are fillers. Fillers are hyaluronic acid based material which we inject into certain areas to bring volume. The commonest areas where we inject fillers are just below the eye over here to bring volume and give a more youthful looking appearance. When you categorize it, the first sign of aging that we all undergo is prominence of the nasolabial folds. These can also be beautifully corrected by injecting fillers and thereby making a person look at least 10 years younger. Fillers are also used for bringing volume to the upper lip and the lower lip. It can be used to give the pout, the so-called Angelina Jolie look, or even Anushka Sharma look that has been given a lot of flack these days. It can also be used to augment the chin and many other indications. Coming to the surgical modalities that I commonly deal with, the commonest being liposuction. Liposuction is a surgical method for which we can remove fat in certain areas of the body which are very, very stubborn and resistant to exercise and diet. Liposuction is not used for weight reduction, but it's just used to shape up the body in certain regions which are very, very stubborn and will not go with plain exercise and diet. Apart from liposuction, other common surgical procedures that we do are rhinoplasty to correct the shape and size of the nose. We do blepharoplasty to correct the sagging of the lower eyelid and upper eyelid, which again is a beautiful modality to make one look much younger. We do hair transplant to bring back hair, which is becoming very, very common. Almost everyone is suffering from hair loss and baldness these days. So hair transplant is a wonderful option for people who want to bring back a youthful look to their scalp. We do tummy tucks for women who have especially had 2 or 3 children and the skin around the abdomen is loose with certain amounts of fat. So to tighten the abdomen and to give a good shape to abdomen, we do tummy tuck procedures. Another common request that I get from patients is cosmetic breast surgeries. Now we have the ability to either increase or decrease the size of one's breast. Breast augmentation is generally done with silicone implantations or fat grafting. We can now reduce the size of the breast, especially in women who have very large breasts and who suffer from back pain and very severe kind of a neck pain because of the increased size of the breast. Or simply we can just tighten the breast to give a more tight and upliftment kind of appearance, which is called as mastopexy. All modalities of plastic surgery are basically done for one single reason. It's basically to look good and feel good, because it's beyond doubt, if you look good and eventually you feel good, you do well, and do well much better in whatever kind of career or employment whatsoever. Thank you.